Think about the lockdown and the impact it has had on their lives in South Africa in particular. A webinar shares the findings from the University of Johannesburg and the Human Science Research Council. It's an online multilingual COVID-19 democracy survey to answer these questions. Let's take you there right now.
Am I audible, Karen?
Crane, please could you tilt your camera a little bit forward? We're looking mainly at your ceiling.
You're certainly audible to me in Joburg, Crane. It's Mark, yeah.
But is the view better, colleagues? I don't really care about views, but is the view better?
The view is much better, thank you.
Okay, so thanks very much, Karen. Thanks to all the colleagues, Kate, Nanya, and Mark, for the sustained work over these last few weeks. And so I think just want to say to you, all of you, that as a country, we are deeply appreciative of this work that has been done. So it's been done under circumstances, of course, that are completely challenging. We've confronted here with a biomedical problem at its base, but in its playing itself out is of course deeply social. So we're going to have to, of course, be thinking about what a cure, a vaccine might look like, and hope that a vaccine will come quickly. But we have to deal, and this is the point about this report, which our colleagues here will share with us here. We have to deal with this disease in its most outward social effects and implications. And this is what I think the big debate in the country is about at the moment. Colleagues are asking, clearly as biomedical scientists are taking us forward and teaching us in wonderful kinds of ways, are asking, where are the social sciences? You know, where are the social scientists, and what contribution are social scientists making to us coming out of this challenge reasonably as a society intact? And it's towards meeting that particular question and request that this seminar is being offered. Of course, it's not the first, and of course we need to be making the point that social scientists around the country have been heavily involved in all kinds of ways in both mitigating and looking forward to what we could be developing in terms of new ways of dealing with the problems of our society. But the issues are really, I think, complicated. We first of all are having to deal with the fact that we have this firewall between the social sciences and the natural sciences, and that's deeply problematic. The MAC, which is advising the Minister of Health at the moment, is dominated by biomedical scientists. There are 51 of them, and they're almost to a person are medics or epidemiologists. And there isn't in that particular community of people enough of a social science way of looking. Now, it's not as if government is not aware of this, but there clearly is a need to come to engage with this biomedical dominance in all kinds of ways. We have to engage with it, first of all, in terms of what its sociological assumptions are, in terms of what it's looking at. So this is a point that I make often. The field of sciences, particularly when they come to look at the human condition, is actually preceded by a sociological understanding of what people are talking about. So demography, for example, is sociological at its base. And we need to understand this. So of course, people are dying, but who are these people? You know, how you describe these people and how you come to understand, you know, where hotspots are is a really important question of understanding what and where the problems might be. But it's also important in breaking this firewall, in coming to understand how illnesses are always socially determined. And that interface between the biological and the social, and coming to understand that interface better is clearly what we all need to be a whole lot better at. So we need to understand biology better, and biologists need to understand the social sciences better, but we need to be taking the lead in all of this, because, and this is the final point that I want to make, Karen, the issues are absolutely intense. Privileged people can manage these issues a whole lot better than people who are in very disadvantaged kinds of circumstances. It's the privilege of information, it's the privilege of resources, it's also the privilege of agency. Of course, people express agency in multiple kinds of ways, but privileged people have ways of dealing with these three things in ways that are a whole lot easier than what people who are disadvantaged, and you can count the multiplicities of disadvantages which people are experiencing in all kinds of ways. And it's this that we're having to confront. In the end, so while this disease may have begun, if you like, out of privileged people traveling, it comes finally to rest in the hearts of sociality, people living with each other, living as particularly poor people in circumstances where they cannot socially distance and so on. So there are really big issues here. And I'd like to close by saying that it's an issue, of course, of personal management, but it's also an issue of social governance. And there are really big questions around all of that. And I'm hoping that our discussion today, Karen, would be both a stimulus and a provocation for us to get to these bigger questions. So thank you again to all of you, and thanks to Karen for leading us in these few hours over the next while. I'll mute now, Karen, and disappear. I'm stopping the video. Thanks.
Thanks so much, Crane. I think what you've said provides an excellent context as to why this kind of research has been absolutely necessary in this period, and important to informing or understanding of what has actually been happening. So without further ado, I'm going to move us on to the presentation by Professor Mark Orkin, who is here today under his capacity as an Associate Research Fellow of the Centre for Social Change at UJ. And he's going to just explain a little about the context and the methodology behind this survey. Over to you, Mark. Mark, if you just unmute.
Maybe that Thabo, there we go. Can you hear me now, Chair?
Yes, we can hear you now.
Right, and let's see if I'll share screen, and I think Thabo's got my presentation as he's got it up already. So let's work with that one. Can everyone see the first slide? Can you see it, Chair?
Yes, I can see it.
Right, off we go. Thanks very much, and also for this very brief opportunity. I was brought into the team, the UJ and HSRC DCS team, because I was collaborating with Professor Kate Alexander, one of the two team leaders, on some quant supervision at UJ, and it really was a very exciting opportunity to participate in, as Crane has pointed out, an extremely important and timely and worthwhile exercise. Now, our chair set some of the context. I had to look up the dates because of the way the days tick by under lockdown in our privileged circumstances. We'll see that at the top of this first slide. Do you remember, folks, that way back in 26th of March, having had a first case expanding through March, we had the beginning of our lockdown, which we subsequently defined as stage 5. And then through April, the discussion was mounting towards possibly reducing from stage 5 to stage 4. And it was in that context that the team hoped to inform government, its advisors, and also civil society and media debate about experiences on the ground that might inform the transitions through the subsequent stages. Now, the last bullet reminds us that this whole exercise could not have occurred without this remarkable resource, the data-free Moya Messenger app, on the platform shown there, which allowed up to 4 people to notice that a questionnaire was being, 4 million people to notice that a questionnaire was being posted and their help was being sought with their opinions. And as someone who's been involved in surveys my whole life, it's often a worthwhile reminder that properly presented surveys in an amenable fashion to women and men in the street present a remarkable opportunity for people to exercise their voice. And this was taken up by nearly 20,000 people. Had we done a shorter questionnaire, I think more of them would have stayed with us to the end. But in fact, even in phase 1, which I'll be demonstrating now, we had 5,841 responses right through to the end, the importance of which is that they allowed us to weight the survey to match a national profile using Stats SA data, and thereby be able to present to potential users and stakeholders a position which could reliably be said to reflect the national perspective. Could we have the next slide, please? Are you ready to give that? Great, thanks. And looking at the data, we agreed to try weighting it by 3 key dimensions that affect attitudes: race, age, and education. And Stats SA data is, of course, enormously differentiated on age and education, and we grouped these categories in order finally to yield a matrix of some 60 weighting cells. Gender didn't need treatment, both before and after weighting. It's what one would expect. And we did try weighting by province, but that would take the matrix up to 540 cells. And that, of course, the sample wasn't big enough. There were 0 cells, and they posed difficulties for weighting. So it's in a true sense a national sample, in that suppose we're talking about an elderly, less educated, colored woman. She and the others like her in the survey are speaking for the nation rather than for her counterparts in one province rather than the other. Now, the key thing in weighting was the distribution of the people who choose to answer this survey. Does that perhaps not hopelessly misrepresent what's out there in the world? And that's why one weights and draws a matrix of key characteristics to match. Google told us that in United States, where telephone polling is ubiquitous, and in our case, opt-in cell phone polling, they hope not to weight any cell, in our case, of race by age, by education, by more than a factor of 5. And we were delighted to find, as the matrix shows at the bottom there, that only in the bottom left of the matrix, i.e. for elderly Black Africans with less than a matric, were we seriously underrepresented. And even seriously wasn't far from the American maximum. And more than that, those particular cells were still quite generously filled, between 50 and 60 people. So those folk had to be amplified. but it was a very differentiated base that we were amplifying. And to my interest and surprise, this meant we really had quite a sound national sample with which to work. You see in yellow that only a handful of other cells even were required amplifying or reducing more than twice. This was extraordinary. This base that we were given access to really achieved remarkable access. Last slide from me, please. Now, here we remind ourselves that we had a whole range of social issues. As Crane has pointed out, this may be a biomedical phenomenon about whether you recover or not and go via an ICU or not to dusty death. But what you have to do about this disease is preeminently a social phenomenon, and whether or not you get it, whether social distancing is observable in a dense informal settlement or in rooms behind formal houses in a township in which a third of our population live, those are absolutely critically social issues. And so the range of issues we felt we needed to cover are shown on the slide. I'll just let you run your eyes down them. And you'll see that in that month, we were able to touch very briefly on a whole range of pointers relevant to the debate. Was there extensive harassment? Was this, really exaggerated by the media? The extent to which people were expressing hunger, and in fact, the one factor that I was then deployed to analyze, which was people's mood in the sense of their experience of fear, stress, depression, and so on, all of which turned out, let me mention, to be very heavily driven by hunger. And that, of course, turned out to be a very big issue between the economists and the epidemiologists about what the relative costs and benefits were. So that's what the survey covered, and I'll hand you back to the chair.
Very much, Mark, for that input. I think, certainly speaking for myself, it makes me feel very pleased and proud of the work that we were able to do, and the fact that we have been able to provide something that gives us some insight into the national picture. So I'll now move us on to the presentation by Professor Kate Alexander, whose presentation is entitled Class, Schools and Masks, What the Data is Telling Us. And I'll hand it over to you, Kate.
Hello, can you see me?
Your video is off. I don't know if you want to put your video back on.
I've tried to put it on, but I'm not able to.
Okay.
We've certainly got a big K for Kate.
Yeah, it says you can't start your video because the host has stopped it.
Okay, so maybe Tabo, if you could make
you can try it now. You can try
your video on. There we go.
Okay. Right. Thank you very much indeed, Chair, and thank you very much, Crane. It's been important what you've just said, and I agree with it wholeheartedly. And I'd also like to thank Mark and my colleagues from HSRC. It's been a privilege to work with you on this project. Let me make one point, and it follows on from what Crane has had to say. One of the difficulties that we face as social scientists is we're not given enough information to work with. The government has information about people who are infected and where they live, and people who die and where they live. And if we were given that information, we'd be able to cross-tabulate it with a range of socioeconomic variables that would help us to understand coronavirus 19 much better. And we'd be able to relate that data also to large-scale surveys such as this one. So we can do much better if the government allowed us to do much better. But what I want to talk about today is the question of class, masks, and schools. And there's my presentation. Okay, so let me begin. For the analysis presented here, I used 3 income categories. These might be regarded as a proxy for class, but class is complex and contested, and I want to stick with income categories. Individuals with an average income less than 10,000 Rand per month were regarded as lower income. Those on 10,000 to 40,000 Rand are middle income, and those receiving above 40,000 Rand are regarded as higher income. A large majority of the adult population, 83%, were in the lower income bracket, and only 4% had a higher income. As you can see from the graph on the right, while the middle and higher groups received most of their income from full-time employment.
Sorry, Kate, just to interrupt you. We can't see your screen. Have you shared your screen?
Okay, I hope that's better then, Karen. Okay, so if you see that screen now, you can see the summary of what I was saying. I was just going on to comment that a large majority of the adult population, 83%, were in the lower income bracket, and only 4% had a higher income.
Sorry, Tabo, have you enabled Kate to be able to share her screen, because we're still not seeing it?
Yes, she can actually share the screen. Just
you try sharing again?
The green button.
I think yes.
Off your screen.
You had to double click or something on the share screen.
Yeah, I am pushing the share screen button several times.
Would you like to email it to us and we'll just show it?
Oh, there we go. We've got it now.
Okay, we're on.
No, Kingsley.
Okay. And is the shared screen all you can see, or can you see other things as well?
So we can see the bottom of your toolbar. If you maybe want to do the view.
Is that better?
That's you got it perfectly now.
Okay, right. Let's try again. Okay. So you can see there a summary of the points that I've been making. I wanted to emphasize the difference between those on a lower income and those on higher incomes. And in particular, that relates to the question of full employment. Whilst the majority of people on middle income and higher incomes are fully employed, that's not the case with people who have lower incomes. Right, so here we're looking at the question of hardship, hunger, and food parcels. First graph, the one in the bottom left, highlights that in lockdown many people had difficulty paying their expenses, with 67% of those on lower incomes strongly agreeing that they were challenged in this regard. There was a large gulf between these adults and those on higher incomes, only 13% of whom strongly agreed with our statement, a difference of 54 percentage points. There was a similar pattern with going to bed hungry, and you can see the graph for that. And 34% of those on lower incomes had been to bed hungry in this period of the lockdown and the period of the survey. During our survey, the proportion of those who went to bed hungry increased somewhat, and this was true even among those on middle incomes. And it's worth noting that last Friday, the Deputy Director of the Department of Social Development told Parliament that roughly 50% of our population is food insecure. And he attributed this to growing poverty and unemployment. Despite the differing experiences of those on lower incomes and those who were better off, a large majority of all adults agreed that food parcels should be given to all who needed them. This was one of the questions that elicited a similar response regardless of income. And all implies South Africans also an interesting finding. The Deputy Director reported that less than 800,000 parcels had been distributed by the department, the Solidarity Fund and non-for-profit organisations. This figure represents less than 1.5% of the population and can be compared with about 30% going to bed hungry, according to our data. Further, the parcels are only expected to last for about 3 weeks, and we have now had nearly 10 weeks of the lockdown. So very many people are now hungry, many are malnourished, and it is likely that some are starving. Let me move on to the financial situation. The two graphs on the left provide us with an interesting contrast. The first of those is how people responded when asked about the general financial situation of people in South Africa, the general economic situation. And you can see there that there are very similar responses from those on lower incomes, middle incomes, and higher incomes. Everybody was very concerned about the general financial position. But then if we look at the graph below that, you can see the response when we asked about people's personal financial situation. And that's quite different. Here, 89% of those on lower incomes were very concerned, and that goes down to only 40% on higher incomes. So an interesting contrast between people's actual experiences and what they felt was the position of the country as a whole. And that the second of those graphs is interesting because it relates to the issue of the extension. This was the extension of the lockdown from what we came to know as level 5 to level 4. And here you can see that the lockdown extension was far less popular amongst people on a lower income. That is, people whose financial situation was much worse than those on the high income. The people in the high income bracket were much more favourably disposed to an extension of the lockdown. And I think it's not unreasonable at all to assume that those who were less well disposed to the extension adopted that view because of their poverty and because of their inability to gain the same kind of income that was possible for them in the pre-lockdown period. So now we go on to think about whether people were taking the lockdown sufficiently seriously. This is the first of 4 slides I want to show on responses. Overwhelmingly, people said that the lockdown was not being taken seriously enough. The proportion of poorer people giving this response was higher than those on higher incomes, 84% compared to 66%. And that's a response which can be followed through when you look at the question of race and you look at the question of housing type. People in suburban accommodations were less worried, 78% of them, not quite so worried in general about whether or not the lockdown was being taken seriously. That was the case of people in informal settlements. So poorer people in informal settlements, more concerned that the lockdown wasn't being taken seriously enough. And if we go on to the next slide, it's about physical distancing. And here you see that it was people on the lower incomes that were much more concerned about lack of physical distancing than was true of people on higher incomes. Have you been keeping physical distance from people outside your household? Well, those in suburban areas, 84% of them said they have been keeping physical distance. But in the informal settlements, the figure was much lower. Not surprising, but what's interesting is that it's these people who are living in informal settlements that are much more concerned about the issue of whether or not the lockdown was being taken seriously. Clearly, it was much easier to practice physical distancing where the population is less dense, people have larger houses and plots, and doubtless can drive to shops in most cases. It is perhaps surprising that the figure for informal settlements is so high, though I should add that in informal settlements where I have been assisting activists with public peer education, we have had considerable success. So we should not adopt a determinist attitude on the relation between informal settlements and distancing. It is difficult, but possible. People value their lives and they do practice physical distancing wherever it's possible to do so. Now, when we come to the question of masks, the pattern is similar. People on higher incomes, those who are white, and those living in the suburbs are more likely to use them than those on lower incomes, who are black, living in townships and in settlements. As nearly always, there is a close relationship between class, race, and where one lives. Let me just add as a side note, I think we must remember that the masks that we're talking about are face masks. The point of them is to cover noses and mouths and fit snugly around someone's face. They're not chin masks. And I make this point because often on the television, one sees, and in real life, one sees people wearing masks to cover their mouth and not their nose. And they're not necklaces either, to be worn around your neck. It's very important that we make this point if we're to save lives and reduce infection. Now, just one more slide before I conclude. And this one is about education. And you can see here that it's particularly people on lower incomes who were very concerned about the negative impact of coronavirus on one's child's education. And in fact, this was a variable where there was a very large contrast between people on lower incomes and people on higher incomes. People on higher incomes, as you'll see there, not concerned to the same degree or in the same numbers as people on lower incomes, and those in the middle incomes somewhere in the middle. Now, one might assume, we haven't investigated this fully, but one might reasonably assume that those on higher incomes were in a better position to ensure that their children could undertake online teaching, whereas those on lower incomes were stuck often in conditions where there wasn't the availability of data, sometimes not the availability of electricity, and often living in very cramped conditions where it was difficult to concentrate. So a number of reasons why people on lower incomes would be particularly concerned about their children's education, and others can be added to that. Other factors can be added to that, including the provision of food in many schools, particularly schools where a large proportion of
Unfortunately, we're going to have to cut out of that webinar from the University of Johannesburg, basically sharing the findings of the University of Johannesburg and the Human Science Research Council on the effect of the lockdown of South Africans. Breaking news.